So for my project, I am focusing on diltiazem or cardizem and how you can titrate it in the condition of atrial fibrillation. So some background on this drug. Diltiazem, generically known as cardizem, is a titratable medication when you give it IV for atrial fibrillation. And I have an image of diltiazem here. This is what it looks like when we pull it from our Omnicell at the hospital and we mix it with the 5% dextrose. When discussing the background of cardizem, it's important to mention that it is a calcium channel blocker. Calcium channel blockers work by inhibiting calcium ions from flowing into the cardiac smooth muscle, allowing the smooth muscle to relax. Although they are not the focus of this lesson, cardizem can treat other conditions like hypertension, chronic stable angina, and paroxysmal supraventricular tachycardia. Before administering cardizem, there are at least 5 things we want to look into before administering it. First, we want to assess the patient's history, like heart conditions, AFib, any prior surgeries they've had. Next, we want to find out what medications they're currently taking. Do they comply and take these medications as they are ordered? Next, we want to assess our patient's vital signs and make sure they're on a cardiac monitor. We want to do an EKG on the patient and repeat the EKG as needed. And we also want to establish a large bore IV and collect labs such as troponin, a CMP, and CBC on these patients. IV cardizem is typically given on a weight-based dose through a peripheral IV or a central line. Usually we give a bolus at 0.25 milligrams per kilogram intravenously over 2 minutes. And if that doesn't work, we can move to a second bolus at 0.35 milligrams per kilogram over 2 minutes. If after 15 minutes these boluses don't correct the rate, we move on to giving the patient a cardizem drip. And this is started at 5 milligrams per hour. The max titration dosage is 15 milligrams per hour. But while they're on this drip, you can titrate them up to, while our patient is on this drip, we can titrate them by 5 milligrams per hour every 30 minutes, depending on if their rate improves or not. But the max dosage is 15 milligrams per hour, so keep that in mind. Titration is usually based on how the patient responds to treatment. If their rhythm converts from that AFib, then we can stop titrating them. In my hospital specifically, once we do titrate their cardizem drip, they're required to go to the ICU or a step-down ICU unit. But if we don't titrate their drip and they're just on a fixed rate, they can go to a telemetry floor as long as they're being monitored by a cardiac monitor. Indications to hold this medication is if the patient's heart rate drops like less than 60 beats per minute, or if their blood pressure is low, such as a systolic blood pressure of less than 90. During the administration of cardizem, there are a few things we need to keep in mind. You definitely want an IV pump that has a good battery, or make sure you plug in your IV pump before you get started. Your patient should be on a cardiac monitor for continuous monitoring. Your patient's heart rate and blood pressure need to be monitored. Any labs that we draw or need to redo, we need to make sure we're doing that on a timely manner, such as troponin levels. We need to keep monitoring those repeatedly. Monitor your patient for changes in respiratory status, any signs of shortness of breath or chest pain. We need to know right away to notify the doctor. And if your patient is taking any oral anticoagulants, we need to monitor them as well, because they'll help you at an increased risk for bleeding. There are some safety concerns we need to keep in mind when administering cardizem. We should avoid giving this to patients with congestive heart failure, acute myocardial infarction, pulmonary congestion, hypersensitivity, and Wolff-Parkinson-White syndrome. A necessary precaution, because cardizem overdose can occur, is to monitor for bradycardia, dizziness, cardiac arrest, and hypotension in our patients. Also, monitor patients for signs of hepatotoxicity. And finally, some patient teaching. Let your patient know these following things. Avoid alcohol and grapefruit juice when taking cardizem. Call your physician or go to the ER if you feel like your heart is racing or pacing irregularly, or you have dizziness, low heart rate, low blood pressure, or chest pains. If you notice that the whites of your eyes or your skin color is turning a yellowish tint, you should seek immediate attention and follow up in the emergency room. Please make sure to follow up with your cardiologist and get your lab work done in a timely manner when you're on this drug. I will include a video of me reconstituting or mixing some diltiazem. Here I am administering cardizem. First thing you definitely want to do is perform your hand hygiene. Our cardizem comes in a vial like this, and you want to mix it with your 5% dextrose. You remove your stopper, and you remove the stopper here. And then there's an inner stopper you have to pull down. And then it hangs on your pole right here.